Is coronavirus an airborne disease? The scientific brief released by WHO as at 29 March 2020, stated that the likelihood of the virus being airborne was very unlikely. After a study that led to the release of that brief, they mentioned that the primary means of transmission of the COVID-19 virus was through respiratory droplets. What is the difference between airborne transmission and respiratory droplets transmission? Airborne transmission refers to spread of disease-causing microorganism through aerosols that get suspended in the air. Transmission through respiratory droplets, on the other hand, contains heavy droplets which do not stay in the air for long. So as at last year, most authorities came out to say that the transmission of the SARS-CoV-2 virus was mainly through respiratory droplets, meaning it was relatively large and couldn't stay in the air for long but could easily fall on surfaces. But a year after the release of the brief, what is WHO saying now about the means of transmission? Has anything changed about the belief that the SARS-CoV-2 virus is not airborne after amassing so much data over the period of 1 year? On 7 May, 2021, the CDC also released a scientific brief which mentions a number of possible means of transmission. These, however, do not necessarily tally with what was released about a year ago. According to the new brief by the CDC, the virus can be transmitted through the following means: 1. Inhalation of the virus. 2. Deposition of viruses on exposed mucous membranes. 3. Touching mucous membranes with soiled hands contaminated with the virus. This indicates that the transmission could be through both respiratory droplets and being airborne as well. What else has changed, and how do we then protect ourselves? Even though the means of transmission seem to be somewhat different than what was thought of about a year ago, not much has changed about the means adopted to prevent transmission. We are therefore encouraged to 1. Observe social distancing. 2. Wear face masks. 3. Ensure adequate ventilation. Share this